Hi, thanks for joining us today. My name's Christopher Guerrero. I'm a doctor of physical therapy, reporting to you live here at Williams Island at the spa. Today I'd like to take a few minutes of your time just to kind of talk through some screening assessment tools that I like to use when I'm working with the tennis athlete. So tennis is a very dynamic sport, so there's a lot of demands on our body. So when I'm working with through an evaluation on the first day with a tennis athlete, I'm going to work on assessing strength. I'm going to look at rotational range of motion from the shoulder. I'm also going to look at some mobility through the spine. It's very important. Oftentimes that's an overlooked part of an evaluation, but we always include that in an evaluation with the tennis player. So David's going to be my assistant for today. So David's a physical therapy student from Ohio University, and he's going to be our demo for the day. You can have a seat there. So to start, we're going to work on assessing external rotation range of motion, which is the rotator cuff muscle system that's important for strength and also dynamic stability of the shoulder. So I'm going to have David start with the arm in neutral, arms out in front of him. So I'm going to assess strength of the external rotation. So here, David, try not to let me move your hands. Good. Okay. So also I'm going to assess for internal rotation strength. So I'll do that one at a time. So David, we're going to say David's a right-handed athlete. So this is going to be his swing side. So don't move your arm. Good. So that's assessing internal rotation. I'll go to the opposite side. So don't move your hand. Good. So oftentimes when we have patients come into the clinic, they're already experiencing pain. They're already going through some shoulder pain. Maybe they've already undergone an injury. So when we're treating the shoulder patient, one of the things we find very prevalent is that external rotation strength is very limited. So we oftentimes include that in their treatment plan. So moving on, we're going to assess strength of the rotator cuff in a 90-90 position. Okay, so I'm going to bring the athlete's arm up into this position here. So I'm going to stabilize the arm here at this point, the elbow, and then I'm going to ask David to don't let me move your arm forward. Good. So here we're assessing external rotation strength, but in this 90-90 position. We'll do the same for internal rotation. Good. Okay. So that's important to assess strength in that position because that's going to be more of the arm position that you'll get into to complete your serve. So from there, other muscle tests that's important to go over are the scapular stabilizers. So one that we'll test next is for the serratus anterior muscle. So this muscle is important for upward rotation of the shoulder blade as well as shoulder scapular protraction. So this allows for the arm to kind of come up overhead to complete the motions of a serve. So for the test position, I'm going to bring the arm into about 110 degrees of flexion, a little bit of abduction here in the scapular plane. So I'm going to provide a downward force that David's going to resist. Also, my offhand I'm going to use to palpate. So I'm going to use to palpate the shoulder blade, make sure there's no compensation there. Also going to palpate under the arm of the serratus muscle to feel for some activation. So David, don't push your arm down. Good. So assessing for strength there, also assessing to make sure there's no compensation or what we would call a scapular winging. Again, moving the arm up into a Y position. Now I'm going to assess for lower trap muscle strength. So David, just hold the arm here. Don't let me move your arm forward. Good. Okay. So that's testing the lower trap muscle, which is important for stabilizing the shoulder blade in the upward arm position. So from here, I'm going to keep David in the seated position. We're now going to assess for thoracic mobility. So it's really important in the clinic to make sure that we have good thoracic rotational range. So that goes in line with when you need your arm to be up overhead. It's important that you can have good mobility through the thoracic spine to allow your arm to be in a good position to complete the serve. So to do that, as a point of reference, I'm going to use a stick across the chest. So David's going to hold that there. To avoid any compensation, I like to use a bolster, or in this case, we're going to use a foam roll. He's going to keep that between his thighs, and that's going to prevent any compensation from the hips. Alright, so here we're going to measure rotational range of motion here. So we're going to go to the left, okay? So we're going to go to his available range here. I'd have a goniometer measuring tool in the clinic, so I take a measure of this range here to the left, and then we're going to have him go to the right. Good. And so here, again, we take measurement on this side, going into right thoracic rotation. Good. So ideally, what I'd like to see is about 45 degrees of motion to both sides. Alright, so now I'm going to have David go into a supine position, so he's going to lay face up for me. Another critical part of the assessment is to go over total rotational arc of the shoulder. So to do this, we need to assess for internal rotation range of motion and also external rotation range of motion. The total arc is just the combination of those two measures. So here I'm going to assess for internal rotation at the shoulder. So I'm going to mobilize the arm with my right hand, and then I'm going to stabilize the scapula with my left. So here I'm going to bring David into internal rotation. So this is motion that's just happening at the shoulder joint, and we're not allowing any scapular motion to happen. So this is pure, what we would call glenohumeral range of motion. So this internal range of motion, I would measure with the goniometer, make note of it, and then now we're going to assess his external rotation range of motion. So here, bringing the arm into external rotation, okay. Again, I'd measure this, okay, get a number, add that to his internal rotation range of motion, and compare that total number to his opposite side. So it's very important for us to compare those two measures, and if there's a significant difference between his right compared to the left, that's going to be something that we're going to need to address. Okay, so also in the overhead athlete and the tennis athlete, it's okay to see an increase or an asymmetry of external rotation range of motion compared to the left and the right side, because that's something that you're going to develop as you play the sport, and that's okay. But the important thing to do is to compare that total range of motion from side to side. So last thing I want to cover is I'm going to have David go onto your stomach for me. All right. So now I'm going to assess for the strength of the rhomboid. So the rhomboids are muscles that act to adduct or pinch your shoulder blades together. So here I'm going to bring David into this test position here, ask him, David, to really try to keep that shoulder blade tucked in nicely. Stay strong. Don't let me move your arm. Good. All right, awesome. So that's another test position and muscle test that we use as part of our assessment. You're all good. You can sit up. So this is just these are just pieces. These are screening tools that I like to use as part of our complete assessment. And these are all things that are important to consider in the overhead athlete, specifically today for the tennis athlete that we assess. So if you're a tennis player, these are some things that you definitely want to check in with. If you find that there's significant limitations, you want to start addressing those. And you can find yourself at a physical therapy clinic like us. We're here at Williams Island in the spa, because these are some issues that you want to address to possibly decrease risk of future injury, and also could be help you with performance on the court. So if you have any questions, please come find us, and thanks for your time.